I like to call the presentation, What Baby Boomers Need to Know About Medicare. Obviously presented by Shawn Brown Insurance. We have multiple offices throughout different states, but our home corporate office is in Daytona Beach on Beach Street. If anybody's familiar with the Crest building, it's a historic, beautiful building right on Beach Street by Jackie Robinson Ballpark. Anytime anybody wants to have a meeting, please get with us. You're welcome to come up. We'll have a cup of coffee, sit at the conference table, relax, and we can discuss whatever it is you need to discuss. So, understanding your Medicare options 2024. Again, there have been some changes, and we're going to discuss those changes in the presentation. Habit could have me say some 2023 things, but I'm going to reference up here to make sure that I don't have any bad habits on old, Part B premiums and things like that, because they have changed. All right, so here's a look at our staff, and ironically, that picture was taken right here. So that's a look at our staff. Shawn Brown Insurance. I'm Shawn Brown. Joe DeSillis is not here. He's our agency general manager. Ernest Teisner, he's one of our brokers. He's also not here. Mark Ham is not here. Kimberly is right up here. Anytime you call the office, you're usually always going to talk with Kimberly. She's the voice of the agency. Douglas Horcher, he is our South Carolina agent. We've got offices in Charleston area. And Michael Heimer, he's out in the Kissimmee area, and Shauna is right here. Shauna is currently our licensed executive assistant. She's really transitioning more into a marketing, B2B sales type role. She's getting more and more educated on these topics, and she's really about at the point where she knows as much about this as anybody else. Who we are, local brokerage with additional offices in Daytona Beach, Melbourne, Lake Mary, Orlando, Jacksonville, West Palm Beach, Bradenton, Savannah, Hilton Head, Charleston, Lakeland, and Fort Walton Beach. Seems like something's missing. Tallahassee is missing, and maybe a couple others. So we've got some offices kind of scattered about. Staffed by licensed insurance brokers with decades of combined experience. We specialize in Medicare Advantage plans, Medicare supplement plans, and prescription drug plans. Not listed, we also do insurance for under 65. So ACA, like exchange health insurance, we do short-term medical, life insurance, et cetera, et cetera. So anything revolved around personal health-related insurance or life insurance we do. However, we don't do auto, marine, home, things like that. If you ever need a good broker for that, please get with us. We'll guide you to somebody that can help you with those things too. We are independent brokers representing every major insurance carrier in Florida, South Carolina, North Carolina, Georgia, Michigan, Montana, Colorado, Tennessee, and Texas. And I feel like something's missing there as well. Alabama, that's right, we just added Alabama. So who is familiar with what exactly this means, an independent broker versus an agent? Does anybody know the difference? We got at least one. So an agent would be somebody who works for an insurance company. So they are trained to teach you about their product, not all products. A broker contracts with every insurance company. That way there's no bias, and we're going to try to align you with the plan that makes the most sense for you based on your needs and budget. Fortunately for us and for you, the consumer, we're paid exactly the same by law, no matter what plan you choose. So we have no financial bias towards any particular plan. Naturally, there's going to be some bias due to our experiences with certain insurance companies. And just like any other industry out there, some companies can be really, really good. Some companies not so good. We try to, one, align you with the plan that makes the most sense based on needs and budget, but we're also going to be honest and transparent and say, hey, this company kind of has a history of this. You might want to look out for that. One really important thing for me as a broker is the support I have with the insurance company. So if you come to me, Shawn, I didn't get this claim paid. Or Shawn, this doctor's in network, but they're not accepting me. Or Shawn, my prescription says it's in the formulary, but it's not being covered. Well, naturally, you're going to come to me for assistance with that. Well, I don't work for the insurance company, so I need to have somebody at the insurance company that will work with me, that will get things done. And there are companies that are outstanding working with brokers. You have a problem, you come to me, I go to that broker liaison, problem gets solved. Bam. Some companies, it's not so easy. So I'm very transparent about those things in the discussion. You know, if it's like, hey, this plan really aligns with your needs, but before we go there, I think you should know this. That's sort of the conversation that we have. All right, we're going to talk about Original Medicare Parts A and Parts B. Who has this card already? Got about 6 of you, 7 of you, okay. Who's expecting this card in the next year but doesn't have it yet? Okay. All right, cool. That's almost the whole audience. All right, sounds good. So most people will have to sign up for Part A and or Part B if you are close to 65 and not receiving Social Security or railroad retirement benefits. You need to sign up at www.ssa.gov. So if you're already drawing Social Security, you're automatically going to be enrolled in Medicare Part A and Part B. So you don't have to do anything. If you're not drawing Social Security, you need to either hop on the website, ssa.gov, and enroll online in Part B, or you can call the Social Security office and enroll that way, or you can go to the Social Security office and do it that way. If you're any bit computer savvy, which it's 2024, baby boomers are pretty good with computers these days, more likely you're going to want to sign up on the website. It'd be the smoothest, easiest way of going about doing it. So it's for U.S. citizens and residents for at least 5 consecutive years, 65 years old, and worked for 40 quarters, which would be equivalent to 10 years. That's what it takes to be eligible for Medicare. You may qualify if you're under 65 and have a disability and have been receiving Social Security disability benefits for 24 consecutive months, end-stage renal disease, or ALS, also known as Lou Gehrig's disease. So you don't have to be 65 to have Medicare. I have clients in their 20s that are on Medicare, and the way that they were eligible for Medicare is they had disability benefits for 24 consecutive months, whatever that might be. It could be an injury they had, it could be an illness, it could be something along those lines. But if they've received Social Security disability benefits for 24 consecutive months, automatically enrolled in Medicare. When can I first enroll? There is a 7-month initial enrollment period, which is the 3 months prior to your 65th birthday, the month of your 65th birthday, and the 3 months after your 65th birthday. That is your initial enrollment period. That's when everybody should be enrolling to avoid any penalties for late enrollment. Part A enrollment, if you are automatically entitled to Part A at age 65, and if you have worked your 40 quarters, you qualify, or you qualify through a spouse. Part A and B enrollments are automatic if you are receiving Social Security retirement benefits prior to age 65. If you are not receiving Social Security benefits, you need to apply, again, as we discussed, through ssa.gov. What if I am late? Part A, there's usually no penalty for Part A if you're late. But Part B, there is a late enrollment penalty, and premiums will be higher after the initial enrollment period unless you qualify for some sort of special enrollment period. It is 10% of the premium per year. So I don't want to get ahead of myself, but the Part B premium this year is $174.90? Is that what it is? So you're looking at 10% of that every month that you would be charged in addition if you're late. Part C, Medicare Advantage, and D, standalone prescription drug plans. You wait until the next annual enrollment period, which is annual October 15th through December 7th. So if you don't enroll in your initial enrollment period, you may have to wait all the way up to another year before you're eligible for getting into a Medicare Advantage plan or a standalone prescription drug plan. General enrollment period for Parts A and Part B for those that failed to enroll without other circumstances is January 1st through March 31st. What if I work past age 65? Obviously very, very common these days. Most people are working past age 65. So you may enroll in Medicare Parts A and Part B. You certainly want to talk to your benefits administrator at your employer before you enroll in Part B. Oftentimes I see where somebody has excellent coverage through their employer, and then they enroll in Part B as well. Now you're double covered, and you don't need to be. If you have qualifying coverage through your employer, you don't have to enroll in Part B because you won't be penalized because you had you had quality coverage prior to. Keep records of your group health insurance coverage with your employer. Good reason for that. I don't want to get too in depth here, but I did have a client, it's going a few years back. I believe she was 82 years old. She worked at a bank. She had just finally left the bank, but that bank had changed hands 4 times since she had turned 65, because you know banks are always selling to another bank. So when she went to enroll in Medicare, Social Security tried to penalize her for that, 17 years worth of not having coverage, but she did. So she had to track down all these prior employers to get verification that she had coverage the entire time. So that was a bit of a hassle for her. So if you are working, make sure you keep a record of your policy that you're in. At retirement, you are eligible for special enrollment period. So again, if it's the middle of the year, it's not the annual election period, it's not your initial enrollment period. If you are retiring and losing coverage from your employer or dropping coverage from your employer, you can enroll in a Medicare Advantage Medicare Advantage plan at that point, or Medicare Supplement plan. Medicare allows 8 months after employer-sponsored coverage ends to enroll in Medicare Part B without penalty. We recommend signing up before retirement to avoid a lapse in coverage. So if you know you're going to be retiring on March 1st, I strongly recommend, as soon as possible, within 3 months of that, get your ducks in a row. That way you don't end up going to April or May or something like that without coverage, which could be bad. This is really important to note. Allow 63 days after employer coverage ends to enroll in Medicare Part D without penalty. So you see here, B, you have 8 months, but D, only 63 days. So my suggestion would be, get it done within 63 days to avoid penalties entirely. This is the income-related monthly adjustment amount for Medicare's Part B and D. So Medicare Part B is $174.70. That's not correct. That's not right, is it? We got a typo in there, guys. I believe it's $174.70. So $174.70 if you are filing as an individual and your income is below $103,000. If you're filing jointly, below $206,000. Most of us in this room are going to fit in that category, and we're going to pay $174.70. And for Part D, you're just going to pay your Part D premium. So if you sign up for a standalone prescription drug plan, they typically have a premium, and you would just pay what that premium is without any additional cost to it, surcharge. Now, if your income increases all the way up to $500,000 and above, you can see where your Part B premium escalates. And same thing with the Part D surcharge. So you could end up being charged more based on your income. Really important to note that the income is based on a 2-year look back. So if you're enrolling in Social Security this year, let's say you're retired, and your income is below this figure, well, it's a 2-year look back. So if you were working 2 years ago, but you were making, $300,000, well, they're going to try and charge you this amount. By they, I mean Social Security. So there is a way around that. There's a form that you can complete that says, hey, I understand that 2 years ago I was making X, but now I'm making X. You complete that form, you send it off to Social Security, they make the adjustment. Usually, if I'm not mistaken, that gets done in under 30 days. I've had a number of clients that have done that. Seems like it's a pretty smooth process. I'm not involved in that process, but if I don't have a lot of feedback from clients, that tells me it probably went smoothly. All right, today we're going to talk about coverage options, Part A, Part B, Part C, Part D, and Medicare Supplement. They're all very different things, so we want to discuss them all. First, original Medicare. That's what's on your red, white, and blue card. It says Part A and Part B. Part A is hospital benefits. You see a little hospital bed here. And Part B, there's some gray area to this, but Part B is essentially outside of the hospital. So A covers the hospital, B is outside of the hospital. Part A, hospital visits, covers inpatient hospital care, skilled nursing facility care, hospice care, and home health care. Part A facts, most people don't pay a monthly premium for Part A. You're entitled to it. You paid taxes all these years. Part A is covered for you. You only pay your deductible For a hospital stay of fewer than 60 days, a Part A deductible is $1,632. So this is really important to note. If you're in the let's say you only have your red, white, and blue card. You don't enroll in a supplement or an advantage plan. See, some people do that. They say, you know what, I'm just going to go with this. If you're in the hospital for one day, it's going to be $1,632. And it's per incident. So let's say you go again 6 months later. Again, that's $1,632. So it's per incident. So that's really important to note on that. You cannot be turned down because of your medical history or pre-existing conditions. So if you've got any pre-existing history, you're about to start Medicare, don't fret, no worries, you're going to be covered. There's no look back as long as you're enrolling in your initial election period or the open enrollment period with Medicare supplement. We'll discuss that in further detail. Stays of more than 60 days. So you know how I mentioned one day could be $1,632? Well, that's also up to 60 days. Same thing. So if you're in the hospital more than 60 days, it shifts to a copay of $408 per day after 60 days. If you're in longer than 90 days, $816 per day for days 91 and above. Obviously, almost nobody that's going to fit their budget. So that's why the overwhelming vast majority of people that are educated on the topic don't just keep original Medicare. Though there are benefits to it, it's too financially risky for most people, so they opt to go into an advantage or supplement. Multiple stays mean multiple deductibles, as mentioned, so it's a per incident. You can go to any qualified hospital in the U.S. that accepts new Medicare patients, which I'm not familiar with a hospital that doesn't. I'm sure there's maybe one out there, but any hospital I know of accepts Medicare. Hospital care outside of the U.S. isn't usually covered. There may be some coverage, but you certainly don't want to rely on Medicare if you do any international travel. I would suggest getting an international policy. They're relatively inexpensive. You can get them through us, you can get them through AAA. There's a lot of different ways that you can get international policies. And what's nice about them is, let's say you're leaving for 3 weeks. You can just get it for 3 weeks, and it's relatively inexpensive. So again, don't rely on original Medicare if you do any international travel, because very limited coverage, if any at all. So now let's talk about Part B. That's doctor and outpatient visits. Services from doctors and other healthcare providers, both in and out of the hospital. That's where I said there's some gray area. Even though if you're in the hospital, you could be charged for Part B as well. So a doctor could come in, check your chart and charge you for Part B and never even talk to them. So that's another reason why it's a little risky just to have original Medicare. Covers outpatient care, surgery, ambulance, outpatient mental health, laboratory services, durable medical equipment, outpatient physical, occupational, and speech language therapy, and some preventative care, all covered by Part B. Part B deductible is $240 annually. So Part B deductible is not per incident like Part A. So you have one deductible, $240 that covers Part B for the entire year. That's going to be important. We're going to bring that up why later. Part B has a monthly premium that is determined based on your income, which is typically $174.70. Yeah, that's correct. May have a penalty and higher premiums if you join after your initial enrollment period. You must wait for the next general enrollment period if you miss the initial enrollment period. I love this chart. I found this online years ago. This really simplifies Medicare. When you're aging in, you're turning 65, or you're starting because you have ALS or disability for more than 2 years, whatever that might be, there's hundreds of plans. But to simplify things, it's like you're at a fork in the road. There's only 3 directions you can really go. There's the route of original Medicare, which we just discussed as Part A and Part B, and then adding a drug plan because A and B don't cover prescription drugs. And this is optional. You don't have to do that. Then there's Medicare supplement, where you still have original Medicare. You have the option of adding a drug plan, and then you add a Medicare supplement plan, which that's often referred to as Medigap, because all those gaps we just talked about with the deductible, with hospitalization, things like that, that's where a Medicare supplement typically picks those things up. I don't want to get ahead of myself, but a Medicare supplement plan, you can essentially go to any doctor, any specialist, any facility, any hospital, anywhere in the country, as long as they accept Medicare. So as we're turning 65, we are used to HMOs and PPOs, right? So we're used to, well, this plan is contracted with these doctors in this hospital and you have to go there. Well, with a Medicare supplement plan, that's not the case. There's no HMO, there's no PPO. Go anywhere you want as long as they accept original Medicare. So a lot of flexibility. There's some reasons why some people may not want to go that route, even though that sounds wonderful at the time. Usually it's going to come down to budget because Medicare supplement plans typically have monthly premiums in addition to the $174.70 for Part B. So it's not going to fit everybody's budget. So some people aren't going to choose a Medicare supplement plan. But if you're looking for the best access to care, supplement plan is the route to go because you can go anywhere you want. If you want to go to Mayo Clinic in Jacksonville, well, they take supplement plans. You can go. If you want to go to Dr. Johnson in Spokane, Washington, there's no insurance plan that says, well, they're not in our network. We're not contracted with them. You can't do that. So supplement plan, go anywhere you want. Medicare Advantage. Now, see, these are two very, very different things. Medicare Advantage is when a private insurance company basically takes over for original Medicare. So it takes your A and your B and your D and it combines it all in one and they call it a Part C. And your benefits are administered through a private insurance company. And we all know those big names. So they basically take over for original Medicare. But when you do that, you're going to have networks. You're going to have HMOs and PPOs and things like that. So with an Advantage plan, you cannot go wherever you want. You have to go to doctors, hospitals, facilities, and specialists that are contracted with the plan. In some cases, if you have a PPO, you can go out of network, but you're going to pay more to go out of network. And it's at the discretion of the doctor. They don't have to accept you. If you can go only if the doctor accepts the terms of the plan, which they generally don't. Let's move on. Medicare Advantage plans. We'll get a little more in detail on that. In terms of popularity, Medicare Advantage plans, most people are familiar with because you see them advertised the most. Most people have Medicare Advantage plans. Medicare Advantage plans are typically a $0 premium. So you pay your $174.70 for Part B, but then you typically pay $0 for the Advantage plan. A lot of Advantage plans actually will pay some or even almost all of your Part B premium. So that makes it very attractive to go into an Advantage plan because you're going to pay less per month. However, you have networks, HMOs and PPOs. Medicare Advantage plans covers Part A and Part B benefits and in most cases includes Part D, prescription drug coverage. So it's all bundled. They call them all-in-one plans. Offered by private insurance companies, there are many different carriers and many different plan options. Let's use this area. Off the top of my head, I believe there's, last I recall, 48 different plan options, something along those lines. So there's a ton of options, but in all reality, we probably only write 5 or 6 out of all of those because most of those plans are either redundant, there's another plan that's just like it, or it's missing some things or has small doctor networks or things like that. So we really hone in when the new plans come out every year. We really break down every plan and look at every copay. We look at all the ancillary benefits. We look at the physician networks, things like that. And we really educate ourselves on the plan before we ever have a discussion with any beneficiary regarding those plans. That way we can more align with, okay, these are your drugs. You're going to get those at the least expensive cost here. Okay, here are your doctors. All right, all of your doctors are in network with this particular plan. And that's how we can try to line you up with a plan that makes sense for you. Often includes additional benefits like eye care, hearing, dental, wellness services, nurse advice, phone line support, gym memberships, and over-the-counter benefits. Some even offer, depends on some variables, but some might even offer assistance with rent or utilities or grocery store allowance, things like that. Typically with those, you have to be dual eligible. You have to have Medicare and Medicaid. So a lot of times you'll see commercials. I'm sure you guys see these commercials all the time. And there's a lot of too good to be true in those commercials, and typically that's because it is. They're advertising these dual eligible plan benefits that very few people qualify for. So they'll kind of bait you into calling an 800 number where you call a call center. And there's a little bit of bait and switch there where they say, oh, okay, well, you're not eligible for that, but we can do this. So you'll see a lot of that. There's some ex-pro football players that you'll see in these commercials and some other gimmicks you'll see. So just be wary of those. Medicare Advantage plans continued, must be enrolled in Medicare Part A and Part B. That's important to note. To have a Medicare Advantage plan or a Medicare supplement plan, you have to have A and B. So some people will just say, well, I'll just get A and I don't want to do B and then get in the Advantage plan. Unfortunately, you have to have both. You can't omit the B. You must live in the plan service area. So sometimes I'll sit down with a beneficiary and they'll say, well, my cousin or my sister in Atlanta has this plan. I want to enroll in that. Well, unfortunately you can't because you don't live in Atlanta. Each geographic area, typically it's by county, is going to have their own set of plans that you can choose from. So you can't just pick your favorite plan from around the country and enroll. You have to live in the plan service area. Medicare Advantage plans do not have underwriting, nor do they have medical questions. So that means you can enroll in a Medicare Advantage plan during the initial enrollment period or during the annual election period, and you'll never be asked any medical questions whatsoever. You're going to be approved. That we'll discuss in a little more detail later. Cost. Plan premiums and terms can change from year to year. Plan can be canceled at the option of the insurer. It's very rare. I've seen it happen a couple of times maybe, where mid-year a Medicare Advantage plan just goes belly up and everybody gets canceled. I don't think that's happened anywhere in this area since 2018 or so. There was a company based out of Orlando that just, they went belly up. But what that caused was a special election period for everybody that was enrolled in that plan to enroll in a new plan. So you didn't have to have a lapse in coverage or anything like that. And in most cases, that worked out better for the people that were enrolled in that plan because that plan was having big issues to begin with. Must continue to pay your Part B monthly premium. Most plans in our area have zero additional premium cost other than Part B. And as I mentioned, many plans these days not only are a $0 monthly premium, but they have what's called a Part B give back, and they will pay you to enroll in that plan. I can't get into the specifics about that because this is an educational seminar, but those are becoming by far the most popular plans. If you want to discuss that option at all, please just get with Kimberly, email me. I'll be happy to discuss it. But there's some that this particular year, there's one or two plans that are far better than any I've seen in the 10 years I've been doing this. So anybody aging in this year, good timing. Plans look really, really good. All right, so Medicare Advantage plans come by HMOs, PPOs, special needs plans, dual eligible or chronic condition. Dual eligible means you have Medicare and Medicaid. And then there's chronic condition plans. So let's say you're diabetic or you have COPD. So they build plans that are specific to your needs in that. Usually, there's some circumstances, but usually, from my experience, those in this area at least, those chronic condition plans aren't that popular because some of the just standard plans that's available to everyone are just as good or better. So it's worth looking into chronic condition plans, but their benefits don't really outweigh what's available to anyone anyway. There's other plans, none locally. PFFS plans, private fee for service. Medicare savings accounts plans, and HMO point of service plans. There's none in this area, so I'm not going to get too in detail on that, but HMO point of service, I can think of one plan locally that it advertises that on the booklet, but it actually only applies to the dental portion of the plan. So that can be a little tricky for people. But point of service essentially means it's kind of like a hybrid between an HMO and a PPO. So you can go outside of the network, but there's some red tape to that. Prescription drugs costs and coverage vary from plan to plan. Rate is not based on age or health. We're talking prescription drug plans now. Benefits can change each year. There are 4 stages in 2023, which this needs to be updated. We're now in 2024. So there's a deductible stage of $0 to $545 annually. There's an initial coverage stage of up to $5,030 in combined costs. Combined costs means what you pay and what the plan pays. So let's say you pay a $5 copay for your prescription, but the plan paid $95. That means $100 is the combined cost. So once you hit $5,030 in combined cost, then you go into the coverage gap known as the donut hole. Who's heard about that? Okay, good news. The overwhelming majority don't hit the donut hole. But there are some prescriptions that are very costly, and they will push you in the donut hole. There's one that's just a lot of people getting prescribed to it in the last few years, last 2 to 3 years, that is pretty much pushing everyone in the donut hole. And once you hit that donut hole, there's a 25% coinsurance for brand name or generic drugs. So let's say the drug costs $1,000, your coinsurance is 25%, you pay $250. But drugs can go all the way up to $10,000 a month in some cases. Fortunately, most people aren't going to experience the donut hole, and it's our job to make sure you avoid the donut hole if it's possible. So if you ever schedule an appointment with us, prior to that appointment, one of the questions Kimberly is going to ask you prior to the appointment is she's going to ask for your medications, the exact name, the dosage, and the frequency. I'm going to do my homework on the back end to make sure you get those prescriptions at the lowest possible cost, or even avoid the donut hole entirely if possible, because every plan has different drug formularies. So you may pay $6,000 a year with one plan for your drug list, but only pay $400 with another plan. So that's really important to note. So you really want to shop around and make sure you're getting the best deal on your medications before you enroll. There's a catastrophic limit of $8,000. Once you reach that catastrophic limit, your medications will all be zero at that point. Fortunately, in the future, this is going down. If I'm not mistaken, if everything sees its way through, that I believe that's going down to $2,000 next year if it makes its way through the chain it needs to make its way through. Coverage is not automatic. Penalties may apply. If you enroll too late, you will pay a penalty of 1% of the average premium per month for each month that you did not have credible drug coverage. Part D 2022 average premium was $31.50. So 1% would be, $3.15 per month. So if you went 10 months without enrolling, you're going to get hit with that penalty each time. So each plan has a formulary of drugs that is covered. Make sure your prescriptions are covered before you enroll in a plan. We'll take care of that for you. Usually a plan changes its formulary cost and tiers every year, so it's very important to check annually. I try to remind every client that I have to shop it every year, but sometimes I don't. Sometimes they just don't like change. So I've got clients that are still in the same drug plan they were in 2016, and they could be paying thousands of dollars less, with a 5-minute email of this is my new medication list. I try to chase them down and let them know, but if they don't act on it, they don't act on it. What we do every year is September, we will email our entire book of business and say, hey, annual election period's coming. Send us your medications. We're going to look at next year's plans and determine what plan you'll pay the least amount for out of pocket. usually it takes about 5 minutes for us to plug that into the database that we have, and it tells us, because I'm never going to remember every formulary, it's impossible, but it'll tell me what plan you'll spend the least amount of money for out of pocket. Out of pocket, I mean, that includes monthly premium, deductibles, coinsurance, and copays. So I can tell you, hey, with plan A, you're going to pay a total of $424 out of pocket. But with plan B, it's going to be $684. Or plan C, it's going to be $1268. And I can break it down to every pharmacy too. So I can say at Publix, it's this. At Walgreens, it's this. CVS, it's this. Or in some cases, I might even tell you, you know, you'll get a much better deal on that medication not using your insurance coverage and use some discount program, which there's a number of them out there. GoodRx being the most popular that most people are aware of. A formulary. Each Part D provider has a formulary. This is a list of drugs that the insurance plan covers. Many drugs have a tiered formulary. That means the plan divides drugs into groups called tiers. Generally, the lower the tier, the lower your copay. So most of your generics are going to fit in tier 1 or tier 2. Most plans in tier 1 and tier 2, there's no deductible. Most plans, not all, but most. Some plans, you're going to have a deductible that starts at tier 3, tier 4, or tier 5, and then some don't have a deductible at all in any tier. But as you can see, the higher the tier, the higher the cost of the medication. Now, it's not totally black and white that generics are here and brand and specialty drugs are here. Sometimes you can find a generic here, but a brand name here. So again, that's why it's really important to actually shop around every year to make sure that you're getting the best deal. Because this year, you could have a drug in tier 2, but that exact same drug with that exact same plan the next year could move to a tier 4. Now, all of a sudden, you're paying a deductible, the copay for it goes up a bunch, and then it could end up costing you a heck of a lot out of pocket. All right, let's talk about Medicare supplement insurance plans. Medicare supplement helps to cover what Medicare Part A and Part B does not pay, such as portions of coinsurance, co-payments, and deductibles. Offered by private insurance companies, plans are named, this is where it can get a bit confusing, plans are named A, B, C, D, F, G, K, L, M, N. Well, we already talked about, on your Medicare card it says Part A, right? Well, then there's a Medicare supplement Plan A. So that can be a bit confusing. So I'll tell you right now, by far, the most popular Medicare supplement plan is right here, Plan G. If you were born prior to January 1st, 2020, it was Plan F. But Plan F is not available if you were born after that date, so then it's G. I will discuss on the next page why that's by far the most popular plan, but essentially it's the most comprehensive. It's the easiest to understand. And we'll get into that. And then there's also some high deductible Plan F or Plan G, which is the same, it's Plan G, except you have a high deductible and a lower monthly premium. We'll get into that. That's, many in the industry call that the best kept secret out there, is Medicare Supplement HDG. The plan is going to have a significantly lower monthly premium than it would if you just go with a standard G, but you got a higher deductible. So if you're healthy, it could be worth the risk to pay less and leave the deductible at risk. But most insurance agents and brokers aren't going to even mention it. Why? Because we're paid a percentage of the monthly premium with supplement plans. So if you're paying a significantly lower monthly premium, the agent or broker is less willing to suggest it. Now, it doesn't always make sense, but you certainly want to be aware of it. So if you have that conversation about supplement plans, make sure to have the conversation about high deductible supplement plans, because it might be a good fit for you. Premiums vary by age, plan, and zip code. That's an important note. There's a dramatic difference in a Medicare supplement plan G, for example, from Miami to here to Charleston. They're all very, very different. So if you move, it could really affect your monthly premium. And if you've got a friend that's in Savannah that's paying X amount for the same plan you enrolled in, they're going to pay a different premium because it's a different area. So that's important to note. Age is another big factor there. When you're turning 65, you're going to get the lowest possible rate. Then if you were to say wait until you turn 72 and then enroll, it's going to be a higher rate. Kind of works like life insurance. The later in life you enroll in a life insurance plan or a long-term care plan, the higher the premium is because your risk goes way up. So that's important to note. Generally, the more comprehensive the coverage, the higher the premium. Regulated and standardized by federal and state laws. So that's important because a Plan G, for example, is a Plan G no matter what company you purchase it from. It's going to have the exact same basic plan design. So when you're shopping, you really want to shop based on, okay, I'm getting the same benefits no matter what company I go through, so I want to make sure I get it at the lowest possible rate, but I also want to make sure it's with a financially stable company. So even though it's the less expensive now, is it going to stay at that rate, or is it not going to have big fluctuations in rate? So that's important. Helps with some of the out-of-pocket costs not paid by Medicare. Premiums vary based on the plan and insurance carrier. Enrollment, your guaranteed issue for Medicare supplement begins the first day of the month that you are enrolled in Medicare Part B, and in most states lasts for 6 months. This is the biggest part of Medicare that people don't know. So if you are interested in a Medicare supplement plan, you are guaranteed issue, no medical underwriting questions, guaranteed to be approved in the first 6 months after you start your Medicare. But after that, there's medical underwriting questions. Okay, so there's a strategy out there where everybody's trying to get the best of it. I'm turning 65. I'm going to enroll in a Advantage plan now because it's a $0 monthly premium, and I'll wait until I'm sick or hurt, and then I'm going to enroll in that supplement plan because I want to avoid paying that extra monthly premium. Well, you can't wreck the car and then call Geico. You can't, it's kind of like life insurance. You got to have it before you need it. So the worst call that I get, and it's pretty frequent, I get it at least every 2 weeks, is I'll get somebody who's referred to me from their doctor, or they find me online or something like that. Mayo Clinic is always the big one. Hey, I just got a diagnosis. I'm in a Medicare Advantage plan. I want to go to Mayo Clinic. I need to apply for a Medicare supplement plan. Which one is going to give me the best deal? I have to be the bad guy every time and tell them, it's too late. You're sick. You can't. And that happens frequently, and that's a difficult conversation to have. So I really want to stress, if you're considering Medicare supplement plan at all, you really want to get into it right when you turn 65 so you don't have to deal with any medical underwriting or anything like that. And the good news is, as we mentioned earlier, Medicare Advantage, there's never underwriting. So if you're in a supplement plan, and let's say it no longer meets the budget, and you want to drop down to an Advantage plan, you can do that. As long as it's during the annual election period, you can drop the supplement, go into an Advantage plan. There's no medical underwriting. It's kind of like a safety net, but it does not work the other way. Hope that makes sense to everybody. Coverage can be denied based upon medical questions at older ages. Coverage goes with you anywhere in the United States. Guaranteed to continue as long as you pay your premium on time and have not made any material misrepresentation on the application for insurance. Here are all the Medicare supplement plans. There's A, B, C, D, F, H, D, F, G, H, D, G, K, L, M, N. So F was the most popular up until 1/1/2020, and that's because it covered everything that Medicare didn't cover. Everything. The difference with G, which is available to you now, if you're turning 65 after 1/1/20, the only thing that G does not cover is the Part B deductible, which this is incorrect. That's now $240. We got to edit that as well. So that's the only thing it doesn't cover. So let's give an analogy. Let's say, God forbid, you're diagnosed with cancer. You go to Mayo Clinic, you're there for 6 months, you get a bill for $500,000. You're only going to owe the Part B deductible, $240. That's it. So that's why anyone with the budget is generally going to end up going into a supplement plan if they're aware of it. They can go wherever they want, and they're only going to pay $240 out of pocket. no matter what happens to them medically. However, the premiums aren't going to meet everybody's budget, so Advantage is a phenomenal secondary option or alternative option. When can I enroll? In most states, there is a 6-month guaranteed issue window, which starts when you turn 65 and/or enroll in Part B. If you are late, you can apply later, but may be charged a higher premium due to age or existing health problems, or rejected entirely depending on your health history. In my 10 years, I have never seen this happen. Charged a higher premium due to existing health problems. It's either you're approved or you're denied, from my experience. I've never seen where, well, you had this happen, so we're going to charge you an extra 20%. It's everything I've ever seen is approved, denied. That's it. Thank you, everyone. On your way out, if you'd like to grab a business card or schedule with Kimberly, you're welcome to. And always happy to help. Thank you, guys.
Thank you very much. Thank you.
My pleasure.